Now we turn to this huge controversy this week about the new advice women under 50 are getting, that they shouldn't have mammograms, shouldn't even engage in self-exams, even though most breast cancer in that age group is found by mammography. The opinion of this panel, which didn't include a breast surgeon or cancer doctor, triggered such confusion and anger, the federal government backed away from it yesterday. And as we now hear from our chief medical editor, Dr. Nancy Snyderman, a lot of women and their doctors aren't buying it either.
3 days after a government-appointed task force released new guidelines for breast cancer screening, confusion still persists at a mammography clinic in New York City.
Patients say, some people are saying yes, some people are saying no, that the doctors can't make up their mind. Should we get the mammogram or should we not get the mammogram? And it's going to cost women's lives.
Women have been getting mixed messages about breast cancer screening for decades.
Tonight, an important development in the fight against breast cancer. For months now, American women have been struggling with the question of mammograms. Finally, a panel of experts said it's up to every woman over 40 to decide for herself. Well, now the National Cancer Institute is going to reverse itself.
And this week, almost immediately after the latest guidelines were released, the backlash began.
I've had a mammogram every year, and I don't know whether I should now or not.
It goes counter to everything that we women have heard over the years.
I think the administration probably underestimated what would be the reaction of American women.
On Capitol Hill, in the midst of the health care reform debate, the partisan lines quickly formed.
This is the toe in the edge of the water that puts you on that slippery slope where gradually, imperceptibly, and even lethally you end up moving toward rationing.
We were actually very pleased that the guidelines came out because we've known this to be true for over 16 years. We've been very frustrated for years and years and years that women were getting a misleadingly optimistic message.
Then, Health and Human Services Secretary Kathleen Sebelius released a statement yesterday, in essence backing away from the guidelines, telling women to, quote, keep doing what you've been doing for years. Critics say it's just politics in Washington.
I think Secretary Sebelius made that announcement distancing herself from the new recommendations because she wanted to save health care reform.
And for women today waiting to get their annual mammograms, it was one more part of a mixed message that has made this a very confusing week.
It is confusing, and I think ultimately women will have to decide for themselves.
It's been a confusing week for women, for their doctors. The panel still stands by its recommendations. But I should say, Brian, this is probably a time for every woman, every doctor to sit down, think about the individualization that's necessary. Nonetheless, the panel says it's battered, but it still stands by the science.
All right, what a mess. Nancy, thanks for your reporting.